Officials are now reporting 5 confirmed cases of locally acquired malaria in Florida and Texas. Concerns are growing as this marks the first time we're seeing local transmission in the U.S. in 2 decades. The CDC is now warning doctors and public health officials to be on the lookout for more cases. Experts say it's bound to happen. And as climate change increases the number of days that mosquitoes are active in the U.S., so joining me now to discuss this is Dr. Shannon Ledoux, senior scientist at the Carey Institute of Ecosystem Studies, and John Brownstein, an epidemiologist, ABC News contributor, and chief innovation officer at Boston Children's Hospital. We appreciate both of you for your expertise this afternoon. Dr. Brownstein, starting with you, break down for us exactly what we're seeing in Texas and Florida with these 5 confirmed cases.
Well, Kena, we have to remember, this is still a small number of cases, and overall risk to the population is low, but it is what we're seeing, something new that we haven't seen in decades. That is locally acquired malaria in those 2 states, meaning that it's not people that have been traveling, it's actual local transmission via these Anopheles mosquitoes that is creating some level of risk. Now, the good thing is that these 5 cases are showing to be improving with treatment, so no deaths, so that's great to see. But it does tell us that there is additional transmission taking place and a real need to conduct surveillance, both in mosquitoes and in the human population, to fully understand how widespread malaria is in the community.
And Dr. Ledoux, your research directly explores how environmental conditions shape populations of disease-carrying animals, like mosquitoes. Help us understand why this is being called locally acquired malaria.
So most of the cases that are documented in the U.S. of malaria arrive from travel. And so people arrive back in the U.S. with malaria infections, and then they recover here. But the local mosquitoes, which are present and could transmit malaria, don't usually bite people during that infection time. And so the idea now is that the cases of malaria that are being documented in Florida and Texas are acquired locally because these people haven't traveled, which means that the mosquito populations in that area have picked malaria up and transmitted it back to humans. And that is an unusual event in the U.S.
Right, that makes sense. And Dr. Ledoux, what leads you to believe that increasing climate change is increasing the number of mosquitoes carrying malaria?
Well, so we have a lot of data that show that mosquitoes, again, are insects, they're ectotherms, so their physiology is really tightly linked to their environmental conditions, and like temperature. And so as temperature increases, their physiology speeds up, and the juvenile mosquitoes, which are an aquatic animal, so they do their whole juvenile lifespan in bodies of water, the duration of time it takes them to go from egg to adult shortens at warmer temperatures. And then as adults, their activities, which of course include biting humans and other vertebrates, also increase with warmer temperatures. And so everything about the mosquito physiology speeds up as temperatures warm. And then on top of that, the development of the bacteria of the in this case, the malaria bacteria, but also other arboviruses that mosquitoes might carry, also speed up with temperature inside the mosquito. And so the whole cycle shortens, which of course means that it can build up in the environment much more quickly. The other thing that's happening is with the reduced winter temperatures, or with the reduction of frost days in the winter, how long it stays cold in the winter, mosquito populations can survive at higher rates. And so you get more mosquitoes each year.
Interesting. And Dr. Brownstein, what symptoms should people look out for? And I know you mentioned that these patients are responding to treatment. What is that?
Yeah, so Kena, we have to remember that malaria can cause a wide range of symptoms, but some of the primary symptoms are fever, accompanied by chills and body aches, but also like flu-like symptoms like headache, fatigue, and sweating, and even sometimes gastrointestinal symptoms. And those can take place about 10 to 15 days after infection, though it can take a bit longer. So it's important to seek out medical treatment and evaluation if you have any of those symptoms, especially if you're in those areas. But we do have a range of treatments. There are oral therapies that exist. In the severe cases of malaria, there's IV treatment. And because this is Plasmodium vivax, it's actually going to need a combination therapy to treat the liver as well, to make sure that you don't have relapse of malaria. But we have treatment, but of course, this is severe and needs to be addressed immediately if you're infected.
Absolutely. And Dr. Ledoux, does your research indicate that this is going to get worse? And is there anything that we can do to counter the effects of these disease-carrying mosquitoes?
One of the important things that people can do to limit their contact with disease-carrying mosquitoes is to reduce the places where mosquitoes breed. And anything that holds water close to places where humans hang out outside could help mosquito populations grow, again, because they do lay eggs and the juveniles have to grow in water.
And Dr. John Brownstein and Dr. Shannon Ledoux, thank you for your expertise. Again, we appreciate that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.